province will offer temporary raises for workers on the front lines of the pandemic as a way to say thank you for their life-saving work. However, respiratory therapists and paramedics have apparently been left off the list and will not qualify for the pandemic pay. CTV's Jordan Reed has reaction.
We're there when the tube goes in, we're there when the ventilator is being used, we're managing the ventilator, and then we're pulling that breathing tube out.
Kelly Hassall, an RT and head of Respiratory Therapist Society of Ontario, says when people stop breathing, RTs take over.
We are now intubating the patient.
So we're leaving our families, just like everybody else. We're going into the front lines, with our capacity that is, and we're helping to do what we do best, which is help the public breathe.
This comes after Premier Doug Ford announced a pandemic payment, providing an additional $4 an hour for frontline workers who are most at risk.
This increase will also help our frontline providers attract and hire extra staff they need.
But left RTs who ventilate COVID-19 patients off of it.
The RTs are they're quite discouraged and they're quite upset.
Paramedics, who are first to respond, were not mentioned either.
It's about caring for patients, which is what paramedics do each and every day, whether it be on a 911 call, whether it be community paramedicine. Our community paramedics currently are in the community. They're swabbing patients and working with Middlesex London Health Unit.
Chief Roberts says while paramedics are deserving of pandemic pay, he feels nothing but appreciation from the government and expects to be added to the list soon. Appeals have been made to the government by the RTSO asking to provide more clarity. Ontario Ministry of Health tells CTV News, "We're grateful for frontline healthcare workers. We're continuing to consult our healthcare partners to determine who meets the criteria for pandemic pay."
It would mean that we are being seen, we're being recognized for our work, and that people are aware of not only the risks that we're taking, but the great work that we do to support the respiratory needs of the public in Ontario.
Jordan Reed, CTV News.